We're at the 25th CROI. We're here in Boston. We're with Anne-Marie France from the CDC, HIV Prevention Unit, and we appreciate you taking the time to visit with us. And you just got completed a press conference where we talked about different forms of prevention, and you were part of that.
Yes, thanks so much for having me. It's a pleasure to be here. So in recent years, we've had exciting new prevention tools that have become available in HIV, and we're really working to try to understand where HIV transmission is occurring, where active transmission is occurring, so that we can understand where these tools are most needed, where we can effectively use these tools to slow HIV transmission in the US. And we've developed an approach to identify clusters where HIV transmission is occurring more rapidly than we see on average in the US. And what we've shown is that our tool allows us to identify where this active transmission is occurring. And that's exciting because that gives us an opportunity to really work with our local and state public health partners to help them assess situations and use our prevention tools to best intervene to interrupt transmission.
Is this, what would, give us an example of some tools, for instance?
Right, so the tool that we use is identifying clusters. These are clusters that are persons infected with similar viruses. And what this suggests is that there has been active transmission in a network. And what that shows us is this is really an area where our prevention tools can really be effective to intervene to interrupt transmission. And that's really what we're trying to do, is most effectively use those tools.
Do you find them to be, the locations to be mostly in big cities, or it could be anywhere?
Right, so what's really exciting about this approach is that it gives us the ability to detect increases in transmission regardless of where it's happening. And so it's a tool that we can employ to really identify those situations that might be in urban areas, but not always. There might be rural areas, suburban areas. So wherever increases in transmission might be occurring that really need additional prevention efforts, we can identify using this approach.
Now, if, for instance, it was like you noticed a cluster in the middle of nowhere as opposed to a city, do you work on the population per capita or something like that? So you say, gee, this is really important because like there's only, or not that it would really be, but half the population, even though it's only 5 people, is infected, whereas over here, it's only like 2% increase or whatever, but it's a big city. But you have to know the number of people in a given area. Am I going down the right path?
Yeah, you raised some important points. So really what we need to do when we identify clusters of active transmission is really assess the situation to understand what's occurring. And really that has to happen in the local level, local or state level. And there are a number of factors that need to be considered. For example, what would they typically expect in terms of the numbers of new infections in an area? How different is this than what they see typically? And how are the prevention efforts that are already going on, the prevention activities already underway, how effectively are they slowing transmission? And so the level of prevention interventions is really going to vary from situation to situation. So basically this is the first step. So we identify a cluster and we need to assess what's needed, assess whether or not it's continuing to grow or whether or not the prevention efforts already underway are effectively stopping transmission.
In San Francisco, Susan Bookbinder was a part of with the public health system there as far as identifying by zip code. So I think that that was one that was done many years ago. I don't know that they're doing that so much in other cities. They mostly, I guess, go by clinics. But you don't know where the people are actually from unless you know the zip code. So, but it's reasonable to understand that there would be certain areas that would be more than others. But that's where they have to put their efforts as far as handing out condoms or whatever it is that they're trying to use to prevent any infections.
Yes, I think we're always trying to understand how we can most effectively use the prevention tools that we have. And this is a new approach, another tool in our toolkit to understand how to do this best. To best slow transmission in the U.S., which is our goal.
Is there anything else that you're moving forward on that would be worthy of discussion, or maybe it's top secret, I don't know.
Well, really, this is the focus of our activity now. We're really interested in really trying to use the data in our national HIV surveillance system to really best understand how we can most effectively use the tools that we have.
And work with the communities. That
Yeah,
are
so
affected.
so there's a lot of work that goes into this. There's a lot of work that we need to do, a lot of work collaborating with our partners to use these tools and help determine how we can most effectively act on this information. So that's really where we're focusing our efforts now.
We really much appreciate you doing this and taking the time and getting the CDC to approve your being here as well.
Thanks so much. It's a pleasure.
Thank you.
Thanks.